Hi, this is Dr. Mila McManus. So it's October. It's Breast Cancer Awareness Month. Really, every month should be Breast Cancer Awareness Month. It's a pretty common problem. It strikes a lot of women and a few men too. I have a very strong family history of breast cancer, so it's touched me personally a lot over the years. I have a lot of patients with breast cancer or who've had breast cancer. So I get a lot of questions about screening. There's a lot of stuff out there. The standard of care is mammograms, right? Go get your mammogram, get the new, fancier, higher radiation mammograms. The important thing is screening is important, but how do you screen? Because the reality is the sooner you catch cancer, the better you are able to deal with it. So, thermography, I have a lot of patients who like to do thermography. Now, none of these images are perfect. And thermography is picking up hot areas in the body that could be red flags. It's not going to pick up a direct tumor. And I have seen thermography miss tumors. I have seen mammograms miss tumors. I have seen ultrasounds miss tumors. So, even an MRI is probably should be the gold standard, but it's more expensive, I guess. So insurance probably doesn't want to pay for it. But MRIs can certainly pick up a lot of detail, but not absolutely everything either. But at least MRIs don't cause radiation exposure like mammograms do. Now, if you want to get an ultrasound, if you refuse mammograms, ultrasound, there is a place called HerScan that offers them. I believe you have to pay cash. I really don't even know how much they cost. But I can tell you if you're using insurance and going through conventional medicine methods, you're not going to be able to get an ultrasound without also having a mammogram. That's just the way it works. So talk to your healthcare provider about all of these options and the pros and cons. And I can't, last but not least, I have to mention liquid biopsies. So there are also options for that out there. We do offer a liquid biopsy that screens, and a liquid biopsy just means it's a blood. We just draw your blood, send it to a lab, and it actually can detect a lot of different cancers. So you get a lot of bang for your buck. So it's not just breast cancer cells that it can pick up floating around in your blood. And then you just know you can do something about it. And we can find these circulating tumor cells in your blood years before it would even show up on a mammogram or other type of scanning. So, like I said, early detection is better. So maybe you do multiple ways of screening. You have to look at your risk factors, your lifestyle, and so many other things. So y'all out there, take good care of yourselves.